ashver.com.
Hello and welcome to ashver.com. You are watching an interesting video on anesthesia has many more effects on the body and body systems.
Please read the disclaimer carefully.
Different types of anesthesia: general, spinal, sedation, nerve blocks and local numbing, affect the body in different ways. Here, anesthesia will refer to general anesthesia. As a physician and anesthesiologist, general anesthesia is the most common type I administer on a daily basis. During general anesthesia, a combination of medications is used together to achieve unconsciousness, inability to feel pain, and immobility so the surgeon may operate. The effects on the body discussed here are the predominant, overall and most usual effects. There are many exceptions and variables that change these outcomes. The most logical way to discuss this might be to address how anesthesia affects the body from head. Effects of anesthesia on the brain. General anesthesia means unconsciousness is achieved and maintained. You are unable to respond to verbal or painful stimuli. Your memory for the time surrounding surgery will be interrupted. Some people suffer postoperative cognitive dysfunction, meaning they have long-lasting effects on memory, mental functioning or personality. This effect seems to occur with any type of anesthesia and is likely caused by a combination of anesthesia and the stress of surgery on the body. Anesthesia providers must have a more thorough understanding of each anesthesia drug and its effect on parameters such as cerebral blood flow, cerebral perfusion pressure, cerebral metabolism, and mouth and throat after general anesthesia. Throat during a general anesthetic, a breathing tube or breathing mask is used to deliver oxygen and gas anesthesia. While we are gentle in placing this device, and it is made of soft plastic or rubber, the throat is very sensitive. You will likely have a dry, sore throat after surgery. This is usually relieved by cold beverages or lozenges and resolves in a few days. The mouth may also feel very dry after surgery. You will receive oxygen by a face mask in the recovery room. This dry flow of oxygen makes you feel dry and thirsty. One of the most common complications of general anesthesia is damage to a tooth during placement of the breathing tube. We use a special curved metal flashlight-like device to intubate. Occasionally, a tooth will be chipped or damaged in the process. This is more likely with those who have large, heavy necks, small mouths, anatomic problems with their face or jaw and a poor overall dental condition. The above photo shows the laryngoscope being used to place an endotracheal tube. This process is called intubation. The laryngoscope may contact the upper teeth, but usually no pressure is applied to transmit it to the teeth. In a difficult intubation, seconds count as there is no oxygen flowing during intubation. The teeth are more likely to be damaged if it is a challenge to place the breath. How does anesthesia affect the heart? The effects of anesthesia on the heart are varied and complex. Overall, a general anesthetic will usually decrease heart rate, blood pressure and the strength of the heart's pumping action. A normal heart and circulatory system will compensate quite well for this. A sick heart, however, requires much attention to the selection, dosages and combination of anesthetic medications to avoid cardiovascular collapse. If you have known heart disease, symptoms of heart disease or cardiac risk factors, you should have a full evaluation by your cardiologist before undergoing elective surgery. The results of the tests should be made available to your anesthesiologist. Unfortunately, even other physicians don't always realize the implications of heart disease on the safe delivery of anesthesia. They will try to be helpful by providing a clearance note, saying patient is cleared for surgery. This tells us only that nothing else will be done by them before surgery. It does not provide any information we can use to tailor your anesthetic to make it as safe as possible. In addition to the clearance note, please request results of your EKG, echocardiogram, stress test, Holter monitor and any other cardiac testing from the postoperative pulmonary complications, the lungs and anesthesia. Issues associated with the lungs, breathing and oxygen delivery are often grouped as postoperative pulmonary complications, PPCs. The depth and rate of breathing are generally decreased by general anesthesia. During your anesthetic, you will have a breathing tube or breathing mask to deliver oxygen. With a breathing tube, the ventilator, respirator, is often used to help you breathe. As you take over this critical function on your own at the end of surgery, you will be told to take deep breaths or cough to expand the airways. This is helpful in reducing the incidence of atelectasis, the lack of expansion of parts of the lungs, and pneumonia. If you smoke, there is conflicting data on how helpful it is to stop at various intervals before surgery. My thought is that it is important to quit anyway, so use your surgery as the motivation to do it. Ask your doctor for nicotine patches or gum well in advance of your planned operation. 8 weeks seems to give the best chance for improving most of the risk associated with smoking. If you aren't able to quit permanently, you will gain some benefit from not smoking in the 12-18 hours prior to your operation. Yes, we are aware that probably isn't going to happen when you are nervous about your surgery, but we have to recommend. Risk factors for PPCs. Smoking, pre-existing asthma and recent airway infections increase the chances of having reactive airways, asthma exacerbations, low oxygen levels and pneumonia postoperatively. Patients who have obstructive sleep apnea are also more likely to have post-op pulmonary complications. Other risk factors for PPCs include advanced stage, poor preoperative health, longer surgeries, more invasive surgeries, surgery of the chest and abdomen, and possibly obese. Liver and kidney function after anesthesia. Liver blood flow through the liver decreases with general anesthesia. Also, many of the medications we use are metabolized, at least in part, by the liver. Most normal livers tolerate these challenges very well. If you have hepatitis or other liver disease, you should see a gastroenterologist before surgery. If your liver isn't working well to start with, it could get worse after an anesthetic. In some cases, liver failure has followed routine surgery and anesthesia on livers that were not healthy to start with. Kidneys. The kidneys also are susceptible to damage due to decreased blood flow. Normal kidneys will not suffer any clinical effects. Kidneys that are functioning poorly before anesthesia and surgery may very well become worse after. Bladder retention is a common anesthesia side effect. Bladder retention after anesthesia is very common. The bladder must contract to expel urine. Through effects on the nervous system, general anesthesia decreases these contractions, leading to urinary retention and abnormally full bladder. Usually, this is a minor, short-lived annoyance. If not resolved, bladder retention could predispose to urinary tract infection. Why do I have muscle aches after surgery? In order to place the breathing tube and make the operation easier for the surgeons, a medication called succinylcholine is given to relax the muscles all over the body. Succinylcholine causes a rapid contraction of the muscles before they relax. This all-over contraction, called fasciculation, can make the muscles feel sore all over for a few days after surgery. In addition, for the length of the surgery, your body is immobile. Your muscles don't contract or move as they do during normal sleep. This also contributes to the feeling of stiffness and aching after surgery. Heating pads and pain medications usually treat this effect. Thank you for watching this interesting and informative video. This channel offers motivational, inspirational, Valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find lot of interesting videos on wide range of topics here. Stay tuned and keep watching.